Well, I'm very excited tonight to have the opportunity to introduce Rob Stevenson. Rob is a registered psychologist with Regina Child and Youth Services. He has been working with teenagers and their families for over 20 years. So teenagers for over 20 years, and he's still standing.
A lot less hair, though.
He is currently working as a program manager on programs that are aimed at health promotion and suicide prevention, as well as suicide awareness. He has also been instrumental in getting the Friends program into many of our schools in Regina. This year alone, over 40 classrooms in Regina Catholic schools have had the Friends training. So whether you know it or not, many of our students have already been the recipients of his shared knowledge. But tonight, we get to be the recipients. So please join me in welcoming Rob.
Thank you. Good evening. Thank you very much. I'm a bit of a pacer, so I'm going to do my best to not get caught up in my cord, but we'll see how that one goes. Thanks for having me out here. I don't get to do as many presentations as I used to, so I really appreciate the chance to talk about things as serious as anxiety. Now, some of you may be wondering why we'd have an entire talk about anxiety. What's that about? Diagnosable anxiety disorders, so things where we would say, yeah, that's enough clinical significance, this is interfering enough to make a diagnosis, are present in about 6.5% of children. And unfortunately, many more children, probably about a quarter of children, will have higher levels of stress and distress and anxiety than we'd like to see. They're people that get aroused easily, they get agitated easier, they feel more upset. It takes them longer to get calmer than we would like to see in people. It's just a little harder. They're wired a little bit differently. Having kids with that level of stress and distress is actually relatively new. We've got studies that take a look at measuring anxiety that have used the same questionnaires for decades. And what they found is that when they give the same questionnaires to kids over the decades, they found that the level of anxiety and stress kids reported has steadily been increasing and increasing. Is this feedback? Can you guys hear? There's a bit of feedback. I'm going to try it like this. Can you hear me at the back? No? Oh. I'll continue it like this. I'm not sure. Is there something we can do to adjust the levels? Our technical guru will get to work. So what we found actually is that by the 1980s, the average level of anxiety in children was about the same as child psychiatric patients in the 50s. That's how much people had changed, how much kids had become more and more stressed and anxious over time, to a point where just the average level that kids felt was notably different to what we would have called symptomatic back in the 50s and 60s. And I thought long and hard, why is that? I haven't really seen any good research that can sort of point to exactly what's changed over time. If we knew that, we could change that, but we don't. So we just know that unfortunately, we have a lot more anxious kids, a lot more anxious teenagers than we used to. And that's a bit of a problem. Why is that a bit of a problem? Well, anxiety, untreated anxiety, is present in about a third of students who just stop attending school at all. So there are some students who will no longer attend classes, and a third of them, it's because of anxiety. They just can't tolerate being around kids dealing with those stressors. We also know that substance use problems are 3 to 5 times more likely in people with anxiety disorders. And it makes sense, right? If you have this state of agitation, feeling stressed, things bother you more. And unfortunately, when people are teenagers, that's when they get exposed to things like drugs and alcohol, and they try it, and they feel different and less stressed. It makes them much more vulnerable to start to look at this as a way of coping in a long-term sort of fashion. The downside, of course, is now you have 2 problems. Before, you're just more likely to feel stressed and anxious, but if you have a substance use disorder on top of that, it adds a whole new set of problems. We also know that anxiety is often associated with depression. About half the people who are diagnosed with depression also have anxiety, and the anxiety seems to kind of come first. Are they kind of 2 halves of the same coin, and people might have got there anyway? They might have. Like that, we don't know enough about how some of that brain chemistry works. But feeling anxious is hard. It's hard to feel stressed. It's hard to always be feeling sort of overwhelmed. It's kind of like, oh, I got to go give a presentation to 100 and something people. Like feeling that all the time. It'd be hard. Some people enjoy it, but if you always have that edginess to you, it can wear on you after a while, that level of stress. So we'll talk about that in a little bit more detail. This last point is one that kind of, this one that makes me the most sad probably, is that anxiety disorders are also associated with a 10-fold increase in suicide risk. And I think, unfortunately, when we've lost youth, especially those youth who kind of seem to have it all, you look at them and you think, man, you know, they seem to be doing so well, so many areas of their lives, and they take their lives for reasons we can't understand. I think, and sometimes we've had psychological autopsies where we kind of talk to everyone around them, that anxiety can be part of that. And so that's one of the things, that's one of the reasons why I think anxiety is something we should be sort of trying to do stuff about. So that's anxiety. It's more present than it used to be. It's common, and let's talk a little bit about why would people start to feel stressed as teenagers? I ignored it the first one, but this is. It went to sleep. Okay, just going to click for me. Click to adolescent development, please. There we go. All right, so let's talk a little bit. And you guys all know this. You're living with teenagers. I assume this is a tough time. There's a lot going on when people become adolescents. You got to get used to the fact that your body is totally changing. You're developing all sorts of different parts, and your arms have got longer, and your legs are longer, and why the heck is hair coming out of here? I mean, there's a lot of stuff that happens, and it happens really fast. People start to change, and so physically you're a different person. You also got to try and figure out how do you get along with peers in a different way. I mean, before you kind of got to hang out with people that you knew and live nearby you. But as you get into adolescence, this becomes much more complicated. And I actually think it's more complicated than it used to be. I think social media and some of the digital ways of connecting with people, we haven't figured it all out yet, but it makes it a lot more complicated than it used to be to kind of, who likes who, and when you say something dumb or do something dumb, most of the time people had forgotten about it by the next week. I can speak from experience in high school. Not everything I said or did was smart. Now, I could have that on YouTube forever. That's really different. What do we do about that? People don't know how, this is a new thing, that this could be sort of out there for a long time. We also got to start to figure out in adolescence how we relate to the opposite sex or the same sex, whoever we're sexually interested in. But that's complicated. It's hard to work out, what's okay, what's not, how do I date, how do I know if he likes me or she likes me or what. There's a lot of stuff going on, and I'm not saying that everybody gets it anyway. My wife could probably tell you I'm still working on it. But it's just in adolescence we're starting to realize there's this whole big skill that we've got to get good at. And that's hard. It's also when we start to separate from parents and adults. Part of being an adolescent is sort of growing on towards being your own person. But, what's that like? How do I get to sort of work out through some of those things? What do I believe in? What's my life philosophy? What am I going to do? What's my occupation going to be? What kinds of things am I going to grow up? What am I spend the rest of my life doing? This is a lot of stuff. So there's a lot of stressful things just naturally about being a teenager that's part of what makes it hard. There's also extra things that can make it stressful. Click. So what might be some of those stressors? Things that might make more stress. Trouble at home, and that can look like all sorts of different things. It can look like conflict. It can look like maybe disruptive behavior. It can look like parents having trouble. It can look like kids. There's just, because they're part of the family system, any of that stuff that can happen there can make those sort of impacts and lead to stressors. Changes in schools. Having difficulties at school. Remember I talked a little bit about, what am I going to do? Where am I going to be? What am I going to work on? It takes, if you start having trouble in school, whether it's behavioral or academic, that's another problem. Being bullied. Unfortunately, it's still less than it used to be, but it's still the case that people in schools, kids in schools, have to put up with things that we would call the cops about if it happened in a workforce. And that's wrong, clearly, but it is part of part of the experiences. Unfortunately, that can happen. Relationship breakups. This is one that, especially with your first love, your first girlfriend, your first boyfriend, when that relationship ends, it's hard. You can't imagine, how am I going to find somebody like this? Those intense feelings, what's that going to be like? So it can be really difficult when that relationship ends. And social struggles. Who do I fit in with? What do I do? Those kinds of things. Click. We also have stressors like balancing school, work, social life, extracurricular activities, family relationships. So I've talked about all sorts of different things that are going on in a teen's life. It's very hard then sometimes to kind of balance all this stuff, especially when there's some competition. There's a big party and I've got a big test. Am I going to be the only kid that didn't go to Mary Jo? Was Mary Jo's? Nobody calls Mary Jo anymore. Sorry to any Mary Jo's. I'm nothing against Mary Jo. But, am I going to go to that party or am I going to study? And how do I resolve that? These are difficult things that people sort of struggle with for the first time. And what to do in regards to drugs, alcohol, sex, where, hopefully our teens are making good decisions. We always hope that. But sometimes, their friends may not be. And then what do they do about that? Or what about when they do try it? Or how do they talk about it? Or those kinds of things. Dating. Just dating in general can be a big stressful situation. Learning to accept yourself, including your gifts and limitations. So part of being a teenager is trying all sorts of different stuff, doing different things. Some of them are going to work out, some of them aren't. But that learning to figure out who you are and accept that can be difficult. Finally, I guess some other stressors: separating from parents, getting good grades, getting a part-time job, choosing a college, university, choosing a career. All of these things are stressors. These are things that may bring about people feeling stressed. They're good stressors sometimes, but they're still stressors. So I'm just going to talk a little bit about stress. Click. Do you guys like that click effect, by the way? It's pretty high tech. So what is stress? You've heard me use it. I think you all probably had an idea what I meant, but what exactly is it? Stress is really kind of, I guess one good way of thinking about it is something called the fight or flight response. And really what it is something that stimulates part of our nervous system, and it leads to a number of physical responses. In the olden days, this stuff was awesome. So when we lived on the plains and we had to worry about saber-toothed tigers coming along and eating us, and somebody said, "Man, tiger!" like our bodies would flood with energy. We'd be geared up. We'd be all set. Are we going to grab the spears? Are we going to run? What are we doing? Come on, let's go. So our bodies are totally set up to respond to environmental stimulus and to mental stimulus, right? You might have been the guy that saw the tiger. "Oh, sorry, man, it was just a bush. But he looked like a tiger, and it made my brain go fast." And so that's kind of what happens. Our brains go fast, our bodies go fast. It's like our sort of have this internal gas that we sort of get into this situation, and something steps on the gas, and our body is flooded with chemicals, and we start to react in a different way. We're faster, stronger, we look quicker, we breathe harder. All of this stuff is really, really good, except we don't live on the plains. And having a body that really reacts very, very quickly to those kinds of things, whether they're in our heads or out there, can be hard on a while. So if you sat in the parking lot after this and you stepped on the gas of your car and stepped on the brakes at the same time, and you did that for the next hour, what would happen to your car? I actually don't know. I've never done the experiment. I think it would be bad for the car. Especially if we gave it as hard as we could. And that's kind of what happens after a while. Is our bodies are revved up for so long, so hard, that we begin to sort of react to this in a way that we call anxiety. So, stress. What happens when we feel stress? Given what I just talked about, recognizing stress, it's going to involve a number of things. When people are stressed, their heart starts to pound, they start to sweat, they have trouble concentrating, they have feelings of unreality, weakness, or dizziness. They feel tired. They get twitchy. They feel more irritable. These are all common signs of stress. And then one of the things you can kind of look for, I guess, if you're thinking about how would I know if my teen was stressed, might be some of these. We'll go click again. What are the signs of stress? Having trouble sleeping can be a sign of stress. Low mood. Loss of appetite or compulsive eating, unexplained headaches, stomach aches, backaches, because our bodies are physically tightened, feeling emotionally keyed up, feeling that tension of being alert, and then sometimes, unfortunately, increased use of alcohol or drugs. So I mentioned these are all common signs of stress, and they're all to do with our body's physical response and to that thing in the environment or our brains that says, "Watch out." When is it a problem? If this has gone on for over 6 months, that someone's been feeling a lot of stress or anxiety, then we're probably looking at, okay, this is starting to get into a problem. And I'll talk more about, so what do we do then in a few minutes? If it's starting to impact areas, so if it's starting to impact school or work or home life, then it's maybe a bit of a problem. The thing about anxiety that makes it tricky is anxiety can be a stressor in and of itself, in addition to sort of being the result of stress. So feeling more anxious means you're that person who saw the tiger first. You react much quicker, and it takes you much longer to feel calm again. And so that makes you more vulnerable in some ways. The people react quicker and faster, and it takes longer for them to kind of reach baseline. So it's a stressor in that way. But again, anxiety can become the result of stress as well. If you feel too much stress too long, it's hard on your system. Let's just click to the next one. I'm going to talk a little bit, real quickly, about anxiety in children. And I'm going to start talking with anxiety in children just for a few minutes, because most of the time when people have problematic levels of anxiety and stress, probably about 70 or 80% of the cases are going to be identifiable by the time someone's 17. Very few people become much more anxious as adults. It can happen, but most of the time it kind of happens in a sort of series of waves. There are some people that are born anxious. Maybe 25-30% of people are born anxious and will appear anxious just from the get-go. You can recognize them even at 2 or 3, and they'll have trouble in grade 1 even, just sort of, they'll feel more nervous, they'll be more shy, they're harder to get, engaged with. Then you kind of have a wave of people that become anxious sort of around 10 to 12, and they sort of, another cohort kind of gets to more, they become sort of aware of the world, and before they were kind of oblivious, and they can become more anxious. So what does it look like, anxiety in children? So people who are, or kids who are clinging, they're more likely to cry or tantrum when you separate. So I'm just going to ask you to think a little bit. If you're thinking about, okay, is my teen anxious? One of the first things to do is kind of think back, okay, what were they like as kids? Because I'm going to talk a little bit. It can be harder to tell as people get older. Were they shy? Did they kind of avoid social situations? Did they? Was it kind of like you had to push them into this sort of get going? Did it seem like they were constantly worrying? Where they're kind of always thinking about, well, what if this happens? Do you think this is going to go wrong? What about? It's kind of this constant worry. They always sort of think about these negative things that might happen. Avoiding situations. Sorry, I just have to take a drink. One of the most problematic things about anxiety is it leads people to avoid situations. And as we'll talk about that, that's kind of got some downsides to it. But what happens, especially in kids, whoa, thank you. Okay. So they tend to, I don't want to go to band practice. I don't feel like going to this. This sounds too hard. They start talking about being sick, and they don't want to go to the thing that they maybe kind of like, but they don't want to because they're anxious, and they want to avoid that anxious feeling that comes along with it. Like I mentioned, they talk about feeling sick, so lots of times when kids are anxious, they have headaches, they have stomach aches, they have back aches, they kind of feel down about things. Or they might even have panic attacks. So they all of a sudden get completely overwhelmed, they're short of breath, they feel like they can't even move, they're just totally overwhelmed. There's so much anxiety that they can't sort of figure out what to do. And that's basically what a panic attack is. So I started with that because anxiety in teens can be a little harder to see because sometimes that tendency to avoid things that make you anxious can make it look a lot like a behavior problem at this stage. So unfortunately, if you're really anxious about going to school, then not going to school makes you feel better. And we tend to do things that make us feel better. But if you don't go to school, that's going to lead to a lot of problems. And so sometimes in teenagers, you start to get, like, kids will start really becoming very argumentative about not doing that. They refuse, they have tantrums. And then some of that can be because of anxiety. And so that's why I think when I'm talking with parents, is this anxiety, I try and start with, well, what were they like as a kid? Because maybe it was anxiety and it started then, and now they've got into this pattern of, I don't want to do this and I'm not going to, and you can't make me. And you can't. Well, you kind of can, but it's very hard to. So, what are we looking for in teens? Where there's real chronic negative changes in behavior. If someone became more anxious, they would be avoiding parents or other kinds of interactions, leaving peer groups, excessive hostility or sadness or worry. Those would all be things I'd be worried about. Lots of chronic medical unexplained stuff, like I've mentioned. Drop in functioning, losing interest in activities, withdrawing socially, poor work performance. Those are all things that I'd be asking you more about if I was thinking, okay, is this some severe anxiety that's kind of got in the way of life? And they're experiencing these kinds of problems. The other one is, do they avoid social interactions? Are they not answering the phone? Do they refuse to talk to a store clerk? Will they never talk to an authority figure like a teacher or things like that? Those could all be signs of anxiety, that people are just wanting to avoid that sort of negative feeling that makes them sort of stressed. Okay, that was a lot of me talking. How are we doing? Any questions so far? Am I that good a presenter that you have no questions? I'll accept that for now. Let's talk a little bit about depression. Like I mentioned, depression and anxiety often go together, but if we're going to talk about one, we do need to think a little bit about this. So a good way to kind of think about symptoms of depression are pretty similar, actually, to stress and to anxiety. Changes in sleep patterns, loss or increase in appetite, especially if there's changes in weight. So if someone loses or gains a lot of weight, that's a problem. It is a problem. Anyway, I'm not going to go there. I wouldn't mind sometimes, not being a person that ate when they felt stressed. Anyway, depressed mood, feeling sad or apathetic. So one of the weird things about depression is that sometimes people stop caring. It's like they don't feel the same enjoyment anymore that they used to. This is that part of their brain doesn't sort of respond the way it used to. Losing interest or pleasure in activities, again, kind of related to that. Something that used to be fun isn't anymore, and people just stop enjoying it entirely, which is a problem. Fatigue, so losing energy, I'm just too tired, I can't get going. Feeling agitated or slowed. Sometimes when people are depressed, they're like they're totally on edge and they can't, it just seems like everything's going wrong. And sometimes people severely depressed will talk very slowly. And it's that part of that system that I talked about that sort of revs people up. Well, there's also a system that kind of slows them down. And that parasympathetic sort of system can get out of whack and people can literally sort of talk that slowly. They're that sort of depressed. Low self-esteem, negative thoughts, really common in depression is feeling like you're a failure, either yourself or the future, or lots of negative thoughts. So it's a very common symptom that those negative feelings can affect them. And then, unfortunately, another symptom of depression is suicidal thoughts, which is one of those ones that we kind of watch for. All right, so I've talked a little bit about some of the signs of stress, and talked a little bit the idea of, too much stress, too long, can become anxiety, or it might become depression, or it might become both, unfortunately. One of the troubling things about anxiety, and I mentioned this a little bit before, is that not facing an anxiety-provoking situation is reinforcing. And because it works. If I don't go to school on the day there's a test, I don't have to feel that nervous, anxious, sick to my feeling, I'm going to feel like I'm going to puke, I just know I will. And if I don't go there, I don't have to write the test. And so that feeling stops. So it's, kind of worked. Except that there's another test next week. Or there's another social situation that you have to get into next week. And so unfortunately, one of the more difficult things about anxiety is it leads people to avoid situations more and more and more that make them anxious. And the more you avoid something that you're anxious about, the bigger your anxiety gets around it. Because it seems like, you've never got a chance to test out that this is actually pretty manageable. Let me give you a couple examples that I'll sometimes use when I'm trying to explain this. So, how many people here, a quick show of hands, how many of you, when you get to the lake, jump in? Quick show of hands, okay. And how many of you sort of slowly ease yourself in? Okay, we got a lot of easers in the room, okay. How many of you want to get used to the water, put your foot in, and then come back out and sit down in your chair? Okay, a few of you. And how many of you touch your foot into the water and then never kind of go back to the water at all? Because that's not a good way to get in the lake, is it? But that's what happens when you avoid things that you're anxious about. You kind of start to get close to it and you stay clear of it. And you kind of get started, you never come back to it. And because you never get in the water, you never learn that, you know what, you can cope with this. It's not that bad. It feels kind of bracing if you jump, or you can kind of ease into it. All of those things work. But if you never step in the water, you never get to learn that you can get used to it. So that's why avoiding is a problem. Does that make sense? The other tricky thing about avoiding is that it kind of creates some ambivalence. And you may have seen right at the start of my talk, I mentioned how few people get treatment for anxiety. Maybe 25% of teens and children will get treatment. Part of that is because they're anxious. And so they don't want to come and talk to a stranger about feeling anxious because I don't like talking to strangers. So, but I also do want to get good at, going out and playing baseball. I love baseball, but I'm too anxious to do it. So there's part of them that feels one way about it, but feels, part of them feels like if I avoid it, that'll work out for me as well. And this ambivalence is a really hard part of getting people into anxiety-related treatments. It's also part of what makes the treatment hard, because if you come to see me, part of my job is going to be to talk to you about doing something that you feel anxious about. That's what treatment, a lot of it is. Breaking stuff down into small, manageable chunks and trying things and discovering that you can get into the lake. That in fact it's not that big a deal. I'm not saying we throw you in. That's actually a bit of a treatment like that. But we teach you how to get into the lake in a way that's calm and helps you to feel comfortable about it. But if you're an anxious person, you don't want to come see me in the first place because that's anxiety provoking. Though you also want to not feel this way forever. But, I haven't even met this person. What if they're no good and I don't like them? But how am I going to get to school if and on it goes. So the thing about anxiety is it creates ambivalence. And this is probably a good time for me to, how do we get through that? It could be that, when people come to see a counselor or anybody, decide to do something about anxiety, it could be that they're a lot like they are at home and just sort of show up. So sometimes when I'm teaching about things, I'll sometimes use the idea of T-shirts. The T-shirts are kind of a way of, sort of letting people know how we're feeling. And so what would your T-shirt say? So I will mention this because I don't know. Sometimes people think when kids come to see counselors, they're wearing a T-shirt that's kind of like this one. Click. So do you? So if you can't read it, it says, "Just tell me what to do." Do you know how many teenagers have come to see me wearing that T-shirt? None. Especially anxious teenagers, because they don't all, again, they're feeling ambivalent about this. So, that's one of the challenges. And I guess if you're here today, that either you're thinking, maybe my kid is anxious, or maybe you want to know more about this. But the chances are pretty good that there's a part of you that's thinking, okay, well, maybe my kid has some anxiety. I'd like to figure out more about how I can help them with this. How do I get them to talk about it? So there's a couple of things that I'm going to kind of mention, and these are tricks that I use. One of the things that I really encourage if you're talking to a teen, and this actually works for all times, is using a lot of I messages. So an I message is where I own it. I feel worried about your marks because you're not going to school. That's an I message. A you message is you're going to fail if you don't start going to school. It's about them. So I messages, people hear I messages a lot easier than they hear you messages. You messages put people on guard. So that's one of the tricks, is to use a lot of I messages. Another sort of trick is don't take it personally when your teen sort of reacts in a negative way. There are times to be a boss, and part of being a parent of a teenager is there are times you have to be the boss, for sure. But there are also times that your teen needs you to treat them like a close friend having a bad day. So if you got to work and one of your friends or coworkers said, "Oh my God, I can't find the USB stick that I need for that presentation this evening," would any of you say, "You know, if you cleaned up your desk a little more, I bet you could find it"? We wouldn't do that, would we? Or if we knew that, our best friend had just broken up with their boyfriend and they were coming to talk about it over coffee, our first thing wouldn't be, if you dressed a little better, I think. We wouldn't do that, would we? But sometimes we get caught up between being the boss, which is where those kinds of, dress appropriately, clean up your room messages are, and we sort of, miss the opportunity to treat someone like a close friend having a bad day. And that's another communication trick that I sort of mentioned, is watch for those opportunities where you can sort of hear they're feeling stressed, they're feeling anxious, and now's the time to listen first and then give advice second. So that's one other trick here is in addition to try and imagine this person as a close friend having a bad day, but also to kind of listen to them and to try and listen and understand where they're coming from. All right. So I talked a little bit about ambivalence. I'm going to talk a little bit about something called the stages of change. And this ties into a lot, like I mentioned, being ambivalent about seeking treatment. So, not many people know this, but most of us don't wake up completely determined to change everything about ourselves. Or nobody does that. So how do you get there? What happens? How do you decide, okay, I'm going to change something about it? Well, there's different stages that we all kind of go through. Often we start out in what we call the pre-contemplative stage. Either I don't see the problem, or I'm not going to do anything about this problem in the next 6 months. I might be able to understand I should be working out a little more. But I could be pre-contemplative. I'm not going to do anything. I'm not going to start running right now. Contemplative is where a lot of people end up, where they're ambivalent. Their part of them feels like, yeah, I should do something about this, but I should also maybe not. And unfortunately, a lot of times when people have troubles changing or getting into treatment or things like that, they're stuck in this ambivalent stage. And especially with teens with anxiety, it can be a real difficult situation because part of them is really used to this works. If I don't ever go to something that makes me anxious, I don't have to feel it. But I actually like to be around friends. I miss going to school. I want to do something. I think I'm a smart person. But it's just too damn hard to get to school and get through those classes. I can't tolerate this. And so people go back and forth. They get stuck in this contemplative stage where they feel ambivalent for long periods of time. It's tricky. Preparation. Fortunately, most people who change get through some of that contemplative ambivalence, and they get to a point where they start gearing themselves up. You know what? There's a lot of advantages to kind of trying this. Maybe I should go to therapy. Maybe I should try something different. Maybe I should do something about this anxiety. And then the action phase is where people start to try these behaviors, and then eventually people get to maintenance, where they're like, okay, you know what? I've got this hooked. I know how to manage these things, and that's what I'm going to do. So that's what we call the stages of change. Does that make sense to people? Have you guys heard this concepts before? Kind of, sort of? Okay. Like I said, the tricky thing is, unfortunately, a lot of times when teenagers are anxious, they're ambivalent about getting changes in treatment to them. Part of what happens is that when people are ambivalent, the more that I give you advice on one side of a situation, the more it is that they start to push back. Have you guys ever had this conversation with your teenager and you're like trying to convince them of something, and no matter what you say, it's like, yeah, but that will work. No, that won't work. No, that won't work. I think we've all had that, where we're trying to convince them, well, try this, do that, help, here's a problem. And the chances are pretty good, that partly they're ambivalent about whatever this situation is. And the more advice we give them about change, the less likely they are to take it, because it kind of sort of like being on a teeter-totter or a seesaw. The more I press down on the side of change, try this, do this, the more they feel drawn to say, nah, that won't work. I can't imagine that ever being effective. Well, that would have worked for you, Dad, back in those old days. But so that's a natural thing that we all do. And it's unfortunate because we feel like when someone's ambivalent, we want to give a lot of advice and talk them in, help them. Sometimes people are looking for that, but if you're ambivalent, chances are pretty good that this isn't actually going to be that effective. So, I'm going to get you guys to practice this. All right, what I'm going to ask you to do is I'm going to ask you to think of something that you're ambivalent about. Could be something really simple, like, should I buy a motorcycle this summer? Probably I won't, but it could be something like that. Should I go back to class? Should I get more coffee or less coffee? Just a small thing that you feel ambivalent about. Okay, has everyone got something, just sort of small? All right, now I'm going to ask you to find a partner, could be the person next to you, and introduce yourself, and then decide real quick, I'll give you 30 seconds, one person is going to try and talk about what they feel ambivalent about. So, I kind of think about buying a motorcycle periodically. The other person's job is going to be to use the opposite of everything I just talked about. So they should be using a lot of you messages. They should be using a lot of negative things. They should be talking to me like I'm a dumb kid. Be my boss. So just sort of see, that's stupid. Why would you buy a motorcycle? Why not just, bang your head against the wall for the next 2 hours? Come on. Just do that for the next minute or so. I want you to just sort of feel what it's like to be ambivalent and have somebody sort of use a lot of advice, a lot of you messages, and a lot of commands and directions and stop that. Does that make sense? You guys clear on what I'm asking you to try? All right, I'll give you a minute and I'm going to walk around.